Mr. President, it's been more than 5 years since Obamacare was signed into law. Since then, the American people have only seen higher health care costs, less access, decreased quality of care, and fewer choices. Every day, I hear from Arizonans who have been forced to give up the health insurance plans that they liked and now face skyrocketing monthly premiums and never-ending wait times for appointments. Moreover, I've spoken with small business owners across my state who have been forced to choose between complying with costly government mandates, laying off employees, or worse, closing their doors. For 5 long years, the American people have been unfairly burdened by this failed law, and the negative effects are only expected to grow. According to the Department of Health and Human Services' own data, 24 insurance plans in the OBAMACARE exchanges were expected to see double-digit rate hikes in 2016, while residents of Phoenix, Arizona, were expected to see their premiums increase by roughly 19%. The highest average premium increase in Arizona was projected to reach a whopping 78%. I repeat, 78%. Obamacare's numerous failures are well established. Take, for example, the president's broken promise that Americans who liked their health care plans and doctors could keep them, skyrocketing premiums and deductibles, 21 tax increases that both the Congressional Budget Office, CBO, and the Joint Committee on Taxation predict will be passed on to the consumer. Over $1 billion wasted on failed Obamacare-established health care co-ops, and an estimated 2 million full-time equivalent workers expected to lose their jobs by 2024, according to the Congressional Budget Office. For these reasons, a majority of Americans today oppose the president's failed health care law, and they're counting on us, their elected representatives in Congress, to fight to repeal and replace it. That's why I was proud to partner with my Republican colleagues in sending the first Obamacare repeal to the president's desk. That's why I'm also proud to stand before the Congress today to reintroduce the Empowering Patients First Act, along with my friend, the senator from Georgia, Senator Perdue, to replace the president's failed law with health care reform that puts patients and physicians back in charge of their health care decisions. The Empowering Patients First Act is companion legislation to a bill introduced in the House of Representatives by Congressman Tom Price that would fully repeal the Affordable Care Act and replace it with solutions that put patients, families, and doctors back in charge of their medical decisions, not Washington bureaucrats. It's past time for my colleagues on the other side of the aisle to wake up to the reality that Obamacare is the wrong solution to health care reform. Just consider a recent report by the Galen Institute, which notes that since the president's health care law was passed in 2010, it has undergone 70 significant changes through either acts of Congress, administrative actions, or the United States Supreme Court. Let me repeat that. Obamacare has been changed a total of 70 times, in many cases through unilateral action, in order to protect the American people from its damaging effects. I am as convinced today as I was 7 years ago when I stood on this floor to propose the first Republican amendment to Obamacare that this law is the wrong approach to health care reform. The bill I'm reintroducing today would create policies that empower patients and doctors to take charge of their health care decisions, including by ensuring no one is priced out of the market, including individuals with pre-existing conditions, building on and expanding the health savings accounts and other models to drive down costs, establishing age-adjusted tax credits for health insurance, equalizing tax treatment of employer-sponsored plans and plans purchased by individuals, by letting individuals buy health insurance with pre-tax dollars, enhancing coverage options by letting small business owners band together across state lines through association health plans to create more affordable and comprehensive health care, letting consumers buy insurance across state lines, curbing defensive medicine and lawsuit abuse through tort reform, and making coverage more portable by enabling individuals to own their insurance, like a 401k plan, so they can take it with them across state lines and if they change jobs. That only makes sense. Americans deserve an alternative to the mandates, high costs, and bureaucratic mess that has been created by Obamacare. The Empowering Patients First Act would repeal Obamacare once and for all and replace it with health care reform that gives patients, families, and doctors the power to make medical decisions, not bureaucrats in Washington.